Welcome back to Capital Review. We're talking to Dr. Anil Mangla from DC Health about monkeypox in the United States and in Washington, D.C. Now, Dr. Mangla, are we looking at a virus that's easily contagious? How does it even spread?
So how does this spread? Number one is it can spread to anybody through close personal contact, often skin to skin. So that's kind of the key criteria. Number two is direct contact with monkeypox rashes and scabs, right? So this is, again, looking at that really close skin-to-skin contact. People also talk about respiratory droplets. This is very rare and not, it's rare because of two things. Number one, these droplets don't linger in the air like COVID, number one. And number two is for respiratory droplets, if you're less than 6 feet in distance for more than 3 hours around an individual, both unmasked, then there may be a possibility of spread. But if you're close to an individual, if you mask, the possibility is very rare for respiratory. So let me reiterate that again. The most important way this is going to spread is, again, close contact and most probably the contact which is skin to skin.
So just to clarify, when you say the close contact, at that time period, would we be able to see the rashes on someone that we would know to stay away?
You could, you're able to see some of the rash, especially the lesions, because what happens in the progression of smallpox, it starts with some rash and then the lesions start on the face area and then it goes around the body.
And are we going to see pharma now hop onto the vaccine train, trying to get something fast-tracked for monkeypox?
Yes, so DC Health has already got a vaccine internally in our clinics, and we are ready. As soon as we find our close contacts, they will be guided to the clinic for the post-prophylaxis.
And probably
post-exposure prophylaxis.
Okay, good to know. When can we expect that to be out, do you think?
As soon as our investigations are over and as soon as our epidemiologists start tracking these close contacts, the first thing is we will have them make appointments at the clinic and get their prophylaxis. So everything is set here in DC. We're ready to go.
Okay, great to know. So probably the most important question right now is, what's the best prevention? What should families and people just know?
Yeah, so that's really important. And I think families need to understand, especially this is the, vacation, it's summer. So there's few things I've really clearly identified is avoid coming into contact with people recently diagnosed with the virus or those who may have been infected or are infected. Number two is wear a mask if you are in close contact with somebody who has symptoms. Practice good hand hygiene, right? We've preached this for years in public health, especially after, coming into contact with someone that's infected or suspected to be infected. For instance, wash your hands with soap and water. And if you have an alcohol-based sanitizer, use that all the time. Use personal protection when caring. So this is more healthcare. When you're caring for individuals or patients that are confirmed with suspected monkeypox infections, make sure you have the proper PPE all the time. So, I mean, those are very key for getting, your prevention regarding the monkeypox that is out there.
And last question before we let you go, what's just your overall view of monkeypox? Is this something that you're worried about?
I think everybody is concerned and worried when they hear of a disease or they hear of a sickness that they're not familiar with. The most important thing is awareness and education of the disease. And if you're aware of what to look for, if you're aware of what to avoid, and you take those precautions, you would be safe with monkeypox.
DC Health State Epidemiologist Dr. Anil Mangla, thank you so much for being here and for your time.
Thank you.
And we'll be right back. You're watching Capital Review.